Yeah, well, stay-at-home orders were thought to be the best way to reduce the spread of COVID-19, but a new study suggests lockdowns did not work. Researchers at Penn State University say the virus was already spreading far and fast by the time lockdowns were put into place. They say although the shutdown may have lessened the peak of transmissions, it did not show statistically significant reductions in critical cases or deaths. They say the main factors in death rates were obesity and low income. Yeah, I read a little bit more about this earlier today, and it sort of piggybacks on what we were talking about earlier, where it's just like everyone has been affected by this, and everyone is different, and every community in every country in every city, etc., is all different. And so it's really hard to, at this point, because it's so new, I'm assuming, get a really clear picture of what has been happening, what has happened, what has led to these spikes. We've talked a lot about California. Northern California has not seen the same kind of spike and return to high number of cases that Southern California always has. Why? I don't know. Are we that much worse at sheltering in place and wearing our masks than Northern California? Maybe. I can't really, that doesn't make any sense. But,
one thing I think about that right now that we're talking about how social distancing might not have worked so well, right before we enacted those rules, we had the LA Marathon. I don't know if you guys recall, the LA Marathon was the last major event before coronavirus hit full-fledged. And I still find it interesting the fact that we went through with that event, given the fact that
we had no idea.
Yeah.
We knew, but not to this extent. Otherwise, don't you think they would have?
Yeah, I guess you're right. I mean, but maybe it was like, well, it hasn't gotten like really, really bad, so we could just do this last event before the world changes, which is exactly what had happened. So,
but it didn't get that bad until late June.
But there's been lots of reports saying that it was bad before then. It was bad before we knew it was bad.
Well, but
do reports like that on a daily basis.
I know what you're saying, but I mean, we do have a number of deaths, right? And we do have a number of new cases, and we do have a number of hospitalizations. Now, testing obviously does impact who ends up getting, or how many people at one certain time statistically have the disease, right? If you're not testing anybody, you don't have any diseases. If you have a disease, if you test a lot of people, you do have a lot of disease. But deaths are, I think, you're either dead or not. There's not a lot of like, oh, well, we're not checking to see what they died of. But I don't know. It doesn't like, I don't know. We've been covering this so extensively. And I think, Sam, what you're saying, as journalists, we try to look and see and understand the information that we get from epidemiologists and doctors and everybody.
Yeah, journalists were kind of masters of none in a good way. Well, in that we have just enough knowledge and ability to read other people's knowledge of subjects in a way that we can vomit it back out to people at home.
Yes, but I also think that there's just, I don't know. It just.
Yeah.
I don't
feel
good about it at all.
And I don't have a COVID test back. So something is failing, something is not working with test returns. Unless you go sit at Dodger Stadium, and the county tests are turning around in 2 days, it looks like. If you go literally anywhere else, I'm hearing this across the board. Last time I talked about this, I got a ton of messages on Instagram or Twitter saying we had the same deal. So lots of people are experiencing, at least in LA or Southern California, these long turnarounds for tests, and that's not good. That's not good.
Sam, knowing what you know and the time that it has taken, and I know we talked about this before because last week I went a week ago today and I got a rapid test. It cost me $125 to see if I had COVID-19. 15 minutes later, I got my response back. Would you pay now?
I'm going to say no because I haven't been in any sort of risk. I just wanted to know when I got the test because Chris's parents were in town for a couple days while his mom had to work here in LA and they stayed with us.
That's now passed. That's done now,
That's now
right?
passed.
Yeah, okay.
Yeah, I mean, we did it out of peace of mind, and then the next day is when Mayor Garcetti was like, unless you have symptoms, do not get tested. So we barely skated around that one. But Andy, I think, I'm going to be off for a couple days next week. This next couple days, my grandpa, unrelated to COVID, has had a couple health episodes, and I want to be able to see him. And even though I'm not going to get near him, that's why I got the test, because I knew I would be doing something today, and it's still 8 days later, not here. So anyway, I haven't been in a super high risk situation, which is why my answer is no, I wouldn't pay the money. But if I was, a peace of mind would be invaluable to me. So I would pay it.